So, yes, battles are important. But then, prevention of the war is perhaps more important. What you are talking in terms of prevention is early detection and early treatment to stop progression, which is actually not prevention. Prevention is much, much before that. You see, even if you can slow down the progression, you will never be able to stop the progression of kidney disease. It will progress from stage 1 to 2, right up to 4 and 5. And that's simply because, India is a tropical country. Neither will you be able to prevent infections completely, nor you will be able to prevent the effect of extreme heat in terms of dehydration, which can worsen the renal failure. So we have to look at primordial prevention much, much before the disease. You talked about food. Are we looking at the healthcare industry causing renal failures? You are an intensivist, I am a doctor too. A single capsule of rifampicin can actually induce acute renal shutdown, which can progress into chronic renal failure. So are we not looking at doing something about, easy availability of medicines to patients, to individuals? I would not use the word patients, to human beings in India. There's no regulation absolutely. Over-the-counter drugs are sold. The people here, they take drugs at the drop of a hat. You have 99.5 fever, you have 100 fever, you pop in a pill of paracetamol. If you go down to the West or the United States of America, they don't use paracetamol even in fever of 103. Unless a person is actually feeling totally incapacitated, they don't advise the use of paracetamol there. So we have to structurally change our behavior. Then we are looking at, the culture is a change towards the so-called processed and ultra-processed food in terms of healthy food or eating outside. This is another thing which is actually contributing to organ failures. So I think we have to do much more than just early detection and treatment. We have to influence the dietary habits of children to prevent the development of renal disease rather than simply prevent the progression. And unless we do that, it will be unmanageable. We produce about 2 lakh patients of kidney failure every year in the country. Are we looking at performing 2 lakh kidney transplants every year? And as of now, I think 80% of our transplants are from live donors. So are we going to look at doing 2 lakh transplants and leaving 1,60,000 with single kidneys? Is that the aim? So when we say we are kidney warriors, we should work actually towards trying to influence prevention of kidney disease at a primordial level. A lot of kidney failures are produced simply because the water quality is not good. People are using groundwater which contain heavy metals and other things. Well, pesticides may be another thing which may be contributing towards renal failure. So there's so many things to be looked at. While we are from an affluent society, we can manage healthy eating. What about the 80% population which cannot even manage the so-called healthy diet? So I think we have to strongly think in terms of that if we actually want to help people with kidney disease, and we have to work at that level to prevent kidney failure. So just sharing some thoughts. So unfortunately, the healthcare industry has moved towards diagnostics and therapeutics. That will never produce a healthy population. The healthcare industry is not interested in having a healthy population because the industry needs to keep itself going. Similarly, the food processing industry is not interested in having a healthy population. Well, they want people to consume unhealthy food. And it's ironical that unhealthy food is available dirt cheap. Even in the West, if you go down to the United States of America, you will get a bottle of Coke, you will get a huge sandwich which is totally unhealthy. at the cheapest price. So most of the population ends up eating that. And the so-called healthy food will be priced so high, it will be out of reach of 90% of the population. So these things are, if this message comes from the influential society, only then will the policies of the government change. I'll tell you a very interesting story about chocolates. You enjoy chocolates? All of us enjoy chocolates actually. So the standards of chocolates internationally say that there should be at least 20% of cocoa in chocolates. However, Indian standards are much lower. Here even 5% cocoa is sold as chocolates. And the rest 15% is made up from sugar. So what are we doing? It's our duty as influential people, as affluent people, to actually try and affect the policies of the government, to talk about these things openly, even in social platforms and social forums, to raise awareness that chocolates, the so-called chocolates with less than 20% content should be sold as confectionery. They are not chocolates, they are confectionery. So that warning at least should come to people. We are warning people for cigarettes. What about the food? Have you ever seen the label of food items, what you take? For example, biscuits or cake rusk or rusk. So the so-called Britannia rusk, which a lot of us consume at times, contains about 25% sugar content.